In today's video, I'm going to tell you how to diagnose hip and knee osteoarthritis from the comfort of your own home, starting right now. Before we jump into the diagnosis part of the video, I'm quickly going to touch on exactly what osteoarthritis really is. So osteoarthritis refers to the naturally occurring changes that happen to all of our joints during our lifetime. We all have a layer of cartilage that lines the articulating surfaces of our joints, and it is designed to act as a strong, smooth surface to provide friction-free movement, and it also acts as a shock absorber when we're moving around and also during impact activities. Just like our skin and our hair, as we get slightly older, the cartilage also changes. It becomes less hydrated, maybe not so smooth, and slightly thinner. And this can make it more susceptible to injury. Generally, it affects our weight-bearing joints more than our non-weight-bearing joints, so it generally affects our knees and hips more than it does our wrists and elbows. It affects nearly 20% of the population in the UK over 45, and in the US, over 35 million people suffer with osteoarthritis. Now, when it comes to the diagnosis of osteoarthritis and what osteoarthritis is, there are a couple of myths that I would like to address. Myth number one is wear and tear. Now, if you're watching this video, there's every chance you've been told you have wear and tear. It is a term that is used interchangeably with osteoarthritis, but it paints this picture of an unhealthy, degenerative joint that inevitably is going to get worse and more painful. The good news is that the research tells us this is actually incorrect. Yes, the cartilage does change and wear over time, but it very, very rarely tears. What actually happens is, just like the rest of our body, the joint is continually undergoing a process of recovery and repair. And there is some evidence to suggest that the joint actually has the ability to lay down new tissue if it has osteoarthritis in it. And this is why flare-ups are common with osteoarthritis. You may notice a good period and then a spike in your symptoms, and then things settle down again. And that's because your body is doing its thing during that flare-up and repairing itself. Now, this may sound like semantics, but words are powerful, and we know that they have a profound impact on how people get better. So why not think of osteoarthritis as wear and repair rather than wear and tear? Myth number two is x-rays. Many of us believe that we need an x-ray to tell us if we have osteoarthritis or not. In actual fact, we know that scans correlate poorly with pain. This is the case with ultrasound scans and shoulders, MRI scans and back and neck pain, and it's the same with x-rays and hip and knee osteoarthritis. You can have somebody with a quite bad looking x-ray and then be in no pain, and you can have somebody with quite a good looking x-ray and then have lots of pain. If you were to take 100 pain-free 40-year-olds and you were to x-ray their knees, the majority of them would have some degree of osteoarthritis despite the fact they're completely pain-free. The reason for this is because pain is very complex. There are many factors that affect the amount of pain we experience, and I've put a whole video together on this, and you can find that in the description below. Worryingly, it's estimated that 1 in 3 people have a joint replacement that they don't actually need. And the reason for this is because clinicians treat the scan rather than the individual. So it's absolutely imperative that we treat you and your symptoms rather than your scan. Now, onto the bit you've all been waiting for, which is how to diagnose osteoarthritis at home. Now, actually, it's pretty simple, but it's important to note that there is a spectrum of severity. At one end of the spectrum, you might have very mild symptoms that mean you can play a whole tennis match for an hour and a half, but your knee is a little bit sore and achy for a few minutes afterwards. Or you get up in the morning and again, your knee or hip is a little bit stiff first thing in the morning and it eases off and you're fine for the rest of the day. However, at the more severe end of the spectrum, it might affect your ability to weight bear, use the stairs, and you could also be getting some night pain. Apologies, I'm interrupting very briefly just to say if you would like to know any more about osteoarthritis or any other pain and rehab related issues, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you for watching and enjoy the rest of this one. Now I'm going to go through 6 signs and symptoms that could indicate that you have osteoarthritis. Now the first symptom is pain in the affected joint. That's a given, right? We mentioned that osteoarthritis is age-related change, so it stands to reason that as you get older, the chances of developing osteoarthritis increase. So the second symptom or criteria would be, have you got joint pain and are you over 50? The third symptom is crepitus. Now this is the audible, generally unpleasant, grinding, grating, clicking type feeling that you can get from the joint. Now for a lot of people, this isn't actually painful, it's slightly more just disconcerting. And if this is the case, it's not something that you need to worry about. Generally, we're only concerned about audible noises from joints if they are acutely painful. Symptom 4 is joint stiffness. Now it's typical if you have osteoarthritis that you may get some stiffness first thing in the morning, generally lasting less than 30 minutes, or some stiffness in the joint if you've been in one position for a prolonged period of time. It may take you a few steps or strides to get comfortable and get moving again. Symptom number 5 is visible bony changes and or tenderness. Now, towards the latter stages of the condition, you can notice some bony changes that occur around the joint and can make it look deformed slightly. You can see this quite commonly in older friends and relatives, particularly around fingers and knuckles. What tends to happen is as the cartilage changes over time, you do get bony growths in the joint and we refer to those as osteophytes. With regards to joint tenderness, it is a lot more relevant when it comes to knee osteoarthritis than it is when it comes to hip osteoarthritis. Your hip joint is very deep and it's surrounded by an awful lot of soft tissue that is very difficult to palpate through. But with regards to the location of the pain, it's more likely to be into the groin, in the front of the hip, but you can also get lateral hip pain and posterior hip pain with hip osteoarthritis. With regards to knee, joint or bony tenderness, it is a lot easier to palpate because the joint is a lot more superficial. So find the kneecap, the bony bit here. If you track down slightly, that's your patellar tendon. It feels like a sort of rope-like structure. If you come either side of that, there should be sort of a hollow groove or dip that is going into the joint. So if you track medially, typically you'll find that the medial aspect of the knee is more sore, if it's sore at all, than the lateral aspect, because the medial aspect ends up with more load going through it day to day. But you might find that if you palpate in this area here, it's a little bit sore and tender to touch. Symptom number 6 is swelling, heat or warmth. Now we know that this is a sign of inflammation. What happens is the body perceives that the cartilage needs help or repairing and it secretes more fluid into the joint. Now this fluid is called synovial fluid and it has 2 main roles. The first one is to act as a lubricator to help the joint move more freely, but it also has a lot of nutrients in it to help with the healing process. Now, if the body secretes more fluid into the joint, it can produce excessive amounts and it can make the joint look bigger and swollen. But ultimately, this is the joint's natural healing process. I'll put some useful links in the description below the video to help you guys manage your osteoarthritis at home, so be sure to check those out. And if you are new to the channel, then do consider hitting that subscribe button so you get notified every time that we release a new video, which we do once a week. You can also show your appreciation for this video by hitting that like button. If you have found today's video useful, you may also find the video useful that I have put together on the different factors that affect pain, and I have put a whole playlist together on how to manage your osteoarthritis at home. Thanks very much for watching, and until next time, I'll see you again very soon.